Hello, I'm Dr. Julie Chan. I'm a plant-based naturopathic doctor and registered acupuncturist in Markham, Ontario. I hope you're all coping well during this time and staying healthy. I know it's been really difficult the last few months, so I appreciate you taking some time out to join me today. I'd like to share a little bit about my experience in helping individuals and families, and I hope this information can help inspire some of you to start making healthy steps towards optimal health. So my focus will be about why adopting a whole food plant-based diet is so important and crucial. In my practice, I see patients of all ages, from young little kids to those with multiple chronic diseases. And my job requires a lot of investigative work and putting the puzzle pieces together, because we assess all parts of a patient, including their mental, emotional, physical, social, and spiritual health, to get to the root of their issues. So before an actual disease manifests, there's often a period of time, maybe months to years, that there are already signs and symptoms of imbalance in the body. And the body will do whatever it can to draw on all the resources to maintain proper physiology for as long as possible. But there comes a time when the body no longer maintains optimal function. So what you will see is the body starts to get tired and worn out, and if nothing is done at that point, things start to break down. And this is when someone starts to show lots of symptoms like fatigue, brain fog, weight gain. Maybe they're sleeping poorly, they're getting frequent colds, or they're having digestive issues and they have skin and hair problems. Their hormones are all off, and maybe they're having mood swings and so forth. And so they get concerned and they go for a checkup, and often their blood work comes back normal, and then they are sent home with no help. And this often leaves people feeling really frustrated because they don't know what's going on with them and why they're feeling so cruddy. So after months and years of unchecked stressors to the body, poor diet, nutrition, and lifestyle choices, eventually it leads to illness, cell degeneration, and the start of chronic disease. And so there's usually this long period of time when there's red flags showing up, but there isn't a diagnosis, and patients don't have any treatments because they're not sick enough to get drugs. So that is where naturopathic holistic medicine comes in. We don't wait until there's a disease formation, because we work on preventing the disease from taking its place. And prevention is much easier than reversing disease. And the most common causes of disease formation that I find is improper diet, poor lifestyle choices, stressors. There could be emotional and mental stress, environmental toxicities. All of this leads to this inflammation in the body. And inflammation is part of a healthy healing process, but when it becomes excessive or deranged, the body will not be able to keep up, and it starts to break down, and then you see this onslaught of issues that people start getting. So their gut's not feeling well, their nervous system is out of whack, they keep getting sick, and so forth. And so the diet really dictates your overall health, because your core health starts from the gut. The gut is connected to the entire body, so the food you eat can influence your mood, your energy levels, your sleep, your digestion, your hormones, your muscle and nerve functions, and immune functions, and so forth. And so it's the most alterable factor that makes the most impact for your body. And that is why I always work on diet with my patients. Now, when you look at all the evidence and scientific studies on nutrition, the amount of evidence that supports a whole food plant-based diet in reducing chronic diseases, in preventing diabetes, cancer, hypertension, and so forth, the studies are so strong that they're just undeniable amounts of information. And these studies have been going on for decades. And so, you know, the research is really all there, right? And when they examined inflammatory markers like the CRP, the group on plant-based diets had much lower inflammation than the group that ate meat. So preventing chronic diseases is crucial in our healthcare system because the top 10 causes of human death, chronic diseases makes up over 90% of that. And in Canada, 4 in 5 people will end up with at least one chronic disease like heart disease, obesity, diabetes, cancer, lung disease, kidney disease. And the risks of all these are vastly lower in people who are following a plant-based diet. So aside from chronic disease prevention, and adopting a plant-based diet being tremendously helpful, let's talk a little bit about this current pandemic, right? This pandemic is a novel coronavirus. It's never been seen before. It's a zoonotic disease, which means it came from animals, just like H1N1, the avian flu, swine flu, Spanish flu, the Ebola. So all of these diseases are considered zoonotic diseases. Did you know that 60% of all human infections and 75% of all emerging infectious diseases are zoonotic? And did you know that zoonotic diseases accounts for 2.5 billion cases of human illness and 2.7 million deaths a year? And the reason why animal diseases start to infect humans is largely due to human activities. When we intensively farm animals, when we eat sick animals and have close contact with them, viruses start to have the opportunity to cross species and start infecting other animals, including us. And so when we look at this, we can see how important it is for us to steer away from animal products. And there's a huge global movement now. Many groups are asking for a global food system rehaul, and that we should be adopting a plant-centric global food system and not a meat-centric one. And when I think about all the people who are getting sick from eating animal products, it's shocking. So many people have gut issues and food poisonings. And if you look at the negative impact it has on our body, it's shocking to see that there's not more being done or more that's being promoted to steer towards a plant-based diet. And one of the things that I have seen, and you probably see on the news all the time, are food recalls. In 2019, 49 of the 50 greatest food recalls in the US were all animal-based products. And not only is meat making people sick, it's also making the planet sick. And there's also a ton of food wastage and animal suffering, of course, right? So another reason meat and dairy is making people sick is also because it's ridden with antibiotics. 80% of all antibiotics produced in the pharmaceutical industry are used for farm animals. And when you eat meat, you're consuming antibiotics. There is an alarming increase of drug-resistant bacteria, which is already a global threat on human health, and it's worsening rapidly. We're seeing serious superbug infections and people dying from simple infections that have turned deadly because none of the antibiotics work. And aside from antibiotics, meat, dairy, eggs, and seafood are also laden with other chemicals. To battle the war against the deadly pathogens that can cause zoonotic diseases like Salmonella, E. coli, Listeria, and so forth, meat processors use things like chlorine baths and ammonia gas and other germ-killing compounds. There's also agents to keep the meat looking red and fresh, so often they use carbon monoxide, and there's lots of preservatives and anti-molding agents just to keep the meat looking fresh. There's often heavy metals found like arsenic, meat glue, vaccines, bugs, parasites, and environmental chemicals. They wind their way into the feed, which is largely from genetically modified crops. There's fecal matter found in pretty much every ground meat sample tested. So you can see that animal products are ridden with toxins, and these toxins end up in our bodies. And we have to process them, we have to detoxify them, and the real fact is that most of it doesn't get out of the body. A lot of it does get stored up, and eventually it will poison our cells as well and cause disease. And the reason why eating plants are different from animals are that animals can bioaccumulate toxins. So what that means is that when an animal eats something, it will store it up just like we do into its cells, and often it's the fat cells where a lot of the chemicals are stored. And so if you think about, milk and cheese, which is coming from the fatty part of the body, it's actually fat, then you will know that as you're intaking these foods, you're also intaking all of these chemicals. And cheese is a huge obsession, but it's laden with dioxins and PCBs and plastics. These are all known carcinogens and hormonal disruptors. So not only are animal products in general, just meat, dairy, and eggs in itself being high in saturated fats connected to a lot of chronic health disease, but they're also very toxic and damaging in other ways. And now we also know they're also a main source of infectious diseases. And we cannot forget about also globally the devastating effects that animal agriculture has on the environment and climate change. And we have a climate crisis now. We're trying to reduce our greenhouse gas emissions, and one of the greatest greenhouse gas emission industries is animal agriculture. Deforestation is also largely caused by animal agriculture. So there's a big connection between animal agriculture and poor planetary health. So the first step I do when I start to try to help people get healthier is first avoid disease-causing inflammatory and toxic foods. The next thing we do is we start to infuse the nutrients that the body needs, because nutrients are what our bodies needs to function. It helps it to regenerate and repair, and many times is people simply aren't eating the right foods. So they're not eating enough variety, they're not eating enough nutrition, and time and time again, I see people come into my office where even people who seemingly eat well, often what I find is they're not eating a great variety. They may be eating the same breakfast every single day, and you can really count up the types and varieties of groceries they get, and they're not getting everything they need. So when we map out nutrient densities, we can also see why the whole food plant-based diet is highly superior. It's because it's much richer in micronutrients. There's more fiber, magnesium, vitamin C, vitamin E, folic acid, potassium. There's more phytonutrients, and the fat is largely unsaturated. So, and there's often this misconception from people that vegan, vegetarian, and plant-based diets are lacking in nutrients, and this is simply not true. Okay, and studies already show that, and one thing that people are very concerned about is iron, and everyone thinks that if you go plant-based or vegan, you're going to become anemic, but studies already show that the iron content in plant-based diets are the same, if not more, than meat-based diets. And so there's similar quantities of protein as well. B12 is universally low in everyone. So whether you are on a plant-based diet or omnivorous diet, you most likely have to supplement with B12. So I'm not saying that the plant-based diet is completely perfect. I mean, there's no perfect diet out there because our environment and soil are so polluted and depleted. And we end up eating all these chemicals that are sprayed in the soil. But I can tell you that of all the diets, the whole food plant-based diet is by far the most healthy, and it promotes longevity, and it has an abundance of nutrients. So, and often there are obstacles, and this is the part, now a lot of people understand the reasons behind, okay, well, I should change my diet, but there's obstacles, and often people are very stuck. And the main reason they're stuck is often because there's false belief systems, maybe there's traditions and misconceptions from misinformation, or simply just a lack of information. And, classic example, I get asked this question every single day is, don't we need dairy? especially families with young children. They're so concerned about their children's growth that they're always wondering, don't they need milk? And you can't blame them, because if you look at the Canadian Food Guide, it's been so ingrained in us for decades and decades that we need to drink milk and eat cheese to be healthy. And so since 1942, the Canadian Food Guide has been highly industry influenced. And we've been taught from when we were young that we should be eating milk and cheese every single day in order to grow. And so a lot of people still have this deeply, deeply ingrained. But I can tell you now that there is really no place for dairy in anyone's diet. As babies, we need milk from our moms for 1 to several years, but thereafter there is no more need for dairy. And if you keep drinking dairy into adulthood, it increases your risk of cancer like prostate, and now we know that it can increase breast cancer risk by 50%. So I'm really happy to see that, finally in 2019, Canada came out with a new Canadian Food Guide, and it got published. And for the first time, it followed evidence-based research. It ignored industry influence. And let's take a look at the difference, between the old food guide and the new one. So this is the general food guide that we have had for decades, and it's varied a bit through the years, but since 1942, dairy has always been a food group of its own, and it's recommended to be consumed on a daily basis. And you can see that here, that meat and eggs and seafood and other animal proteins also have a food group of their own. And then you have the grains and the fruits and vegetables as a third and fourth food group. Then in 2019, there was a complete overhaul to the Canadian Food Guide. So first of all, they dropped from 4 food groups down to 3, and the recommended portions of fruit and veggies had doubled. So right now you can see it's half of the portion of what we should be eating should be fruits and vegetables. And the meat and animal protein group and dairy groups are now completely gone. They've all been clumped into the protein category. And so straight from the food guide, it says, protein foods, including plant-based protein foods, are an important part of healthy eating. And the first things they mention are beans, lentils, nuts, and seeds. And all the animal products are then listed afterwards. And then you can see that this new food guide recommends much less meat and dairy intake and many more plant-based foods. And if you look at this guide, essentially meat, dairy, and eggs are not even an important part of the diet, and you can actually live without them if you look. So there's our improved Canadian Food Guide, and I'm so glad that it's been published. When I started practicing 14 years ago, I wasn't vegan yet, but I removed dairy from all of my patients. And I was astounded because people would come back reporting their digestive issues were better, their skin was clear, and even their pain had reduced. So in the last 14 years, I can say the majority of my patients have benefited from removing dairy from their diet. Now, another concern that I often get from people pertains to soy. There is so much confusion when it comes to soy because earlier studies showed that isoflavones, which are the plant estrogens found in soy, promoted estrogen receptor positive breast cancer in mice. But they later discovered that mice and humans metabolize soy differently. So the blood levels of isoflavones found in mice were much higher than what would result from humans consuming soy foods. And although isoflavones look like animal estrogen, they bind differently to the body's estrogen receptors, and they have different effects. Unlike body estrogen, which acts like estrogen all the time, isoflavones can promote or suppress estrogen effects. So that's why they're considered selective estrogen receptor modulators. Now, in regards to cancer, there have been no studies linking soy consumption to increased risk of any cancer. On the contrary, there's a lot of evidence that show that soy is protective against lung cancer, breast cancer, prostate cancer. Isoflavones can suppress tumor growth and even turn on genes that slow down the growth of cancer cells. In fact, patients who have had cancer have shown to have better survival rate when they eat soy. And eating soy can reduce cholesterol, hypertension, and it increases even healthy gut bacteria. And when they did reproduction studies, they found no issues with testosterone issues at all in men. And now even the American Institute of Cancer Research supports eating organic soy foods. So, you know, I hope this solves your confusion with soy. It is such a nutritious food. Just make sure that you do eat organic, non-genetically modified soy. There's just such a widespread amount of benefit to consuming it, and it will make the transition to a plant-based diet so much easier, and it's so delicious too, and there's so many ways to cook it. So I hope I've answered some of your questions today, and hopefully you feel inspired to take charge of your health. And thank you so much for watching, and please stay safe.